One of the main differences between children and adults with leukemia is that many children inherited cancer susceptibility gene, which is very important for the pathogenesis and for the treatment of the patients, and also important for the family. So we know that there's a peak age for acute lymphoblastic leukemia in children. Most children was diagnosed with leukemia between 2 to 5 years of age. This is very onset of ALL. In the past, we do not know why. We have all kind of theory, infectious disease theory, and then or isolation theory. But we now know that it's mainly is due to the germline cancer susceptibility genes. So we also, by studying the germline, we also know why there's a racial ethnic differences in the type of leukemia. And also we know why most patients develop B-cell ALL instead of T-cell ALL. We know a lot. They can all explained by the germline polymorphisms. And also we now know that it is very important to find out if the patient have inherited any cancer susceptibility gene. Our early study found out that perhaps 4 to 5% child ALL have cancer susceptibility gene. At that time, we only studied 60 cancer susceptibility genes, but now when we expanded the candidate gene to 150, now we found that almost 9% of children have cancer susceptibility gene, but I'm sure we found even more. To know cancer susceptibility gene is very important because it affects how the patient responded to treatment, and also tell us what kind of treatment we should avoid, because when patients have cancer susceptibility gene, they're also more likely to develop second cancer. So we have to avoid radiation, we have to avoid the carcinogenic agent. And this is for patients. So we need to know that so that we know how to properly treat the patient. However, it is also very important to the family member. When a patient have cancer susceptibility gene, that means some of the siblings or maybe even the parents have cancer susceptibility gene. And perhaps the family wants us to screen it because they want to identify those with the cancer susceptibility gene so that we can monitor them for early detection of cancer, so that now the children with leukemia actually can save the family member. As a matter of fact, we have already screened almost 80 families who have a child with leukemia and a cancer susceptibility gene. We found that 1/4 of them actually we found out that some of the family members had cancer susceptibility gene. In fact, some of them we actually, by screening and monitoring them, identify early onset of cancer so that we can treat them earlier, so improve the cure rate. So this is very important. I think this is not only limited to children with leukemia. I think actually patients with solid tumor and brain tumor, they probably have even higher incidence of cancer susceptibility gene. So this is a new field, but this is very important new field because it's not only important for the patient himself or herself, can also affect the family member.